السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين نبينا محمد وعلى آله وصحبه أجمعين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. أما بعد. Brothers and sisters, thank you for joining us today in this beautiful program. We're joined by two distinguished guests as well as many lovely brothers and sisters. You might be joining us from the UK or somewhere around the world. Wherever you are joining us from, welcome. A couple of house rules before we begin. If I can ask everyone that's joining us, if you can mute yourself. If you want to have your video on or off, it's entirely up to you. You can have your video on. Myself and the two speakers are going to have their video on all the time. And we are going to explore a few different topics, inshallah ta'ala. If you want to ask any questions at any point, if I can request you to just take notes and save it till towards the end. We are going to have a Q&A session where you can put your questions to our panel of guests, and you can then ask those questions via the chat facility, and we'll get them answered, as many of them as we can, inshallah ta'ala. So the key themes today are the poverty-induced mental health problems, anxiety around bills, inflation, and cost of living, the scale of the issues that the Muslim community is facing in terms of mental health. And we're also going to hear a couple of human stories related to the topic and what support is available out there for the Muslim community and what is being done currently. Before I go any further, let me quickly introduce the two speakers. We are very privileged and honored to be joined by Dr. Siddiqui, who is a GP with over 10 years of experience of working in Newham, East London area, an area with high levels of poverty and deprivation. She is a mental health clinical lead for Northeast London Integrated Care Board, NELICB. That's a very long name. She's an expert advisor for NICE Technologies Advisory Community for guided digital therapies for adults with depression and anxiety disorder. She's also a GP trainer for the De-Stress Research Project with UCLP and University of Exeter. Dr. Imrana Siddiqui delivers training to GPs in London and the Southeast on best practice in managing poverty-related mental distress. So we are honored and pleased to welcome. Assalamu alaikum, Dr. Imrana.
Wa alaikum assalam wa rahmatullah.
Thank you very much for giving us your valuable time. We're really honored.
Thank you, Jazakallah khair, for that introduction. Yeah, very humbling introduction, Jazakallah khair. So just a thank you to our participants as well who've joined on a Thursday evening. I thought we'd kick off by just kind of my experiences of what I've seen with patients in terms of cost of living crisis. Just for context, as we said, Newham, where I work, is a highly deprived area, but also it's very ethnically diverse, and the most ethnically diverse within London, and more specifically in terms of Muslims. The latest statistic shows 42% of our population are identify as Muslim. So that's the highest in London and possibly highest in the world. So this is in the country rather. So this is very relevant for where I work. In terms of, I mean, just again for context, this cost of living crisis hasn't happened in a vacuum. We've had many years of austerity, and we know the disproportionate impact of the COVID-19 pandemic on our communities. So it's really kind of a hardship upon a hardship. Having said that, on the flip side, throughout the pandemic, we saw how our patients and our communities showed resilience through these hard times. And in terms of the upcoming winter, I think patients are already feeling the pinch. And if I just give you a few snippets of some of the patients that I've seen, for example, I had one lady I saw last week in clinic, and she needed a referral to the hospital. So I did her gynecology referral. I passed her the paperwork, and then I saw her face fall, and I couldn't quite understand. So when I teased it out, essentially for the patient to book the appointment, she has to go online. She doesn't have online access. There is another option. She can make a phone call and then book her appointment. But to make that phone call, it's charged at local rates, and it's not a free phone. And that was the difference between her being able to make the appointment or not. Again, I had another patient who had a fairly straightforward condition which needed just straightforward medications as treatment, was prescribed by my colleague, and then again she came back to see me a week later, and when I inquired, she hadn't had her medications, and I was puzzled as to what, why did she not take the treatment that was advised. And she said when she went to the pharmacy, they had said to her that they're charging her £30, and because it was 3 different medications she needed for that one condition, she had to pay 3 costs, and that was too much for her. And then also, again, I know today we're talking about the mental distress caused by the cost of living crisis as well. So again, I saw this patient who was not sleeping at night. She was very anxious, and then so I went through the questioning and assessment of anxiety, and then we started talking about treatments, and in terms of what treatments were available, and I was offering her psychological therapies, and then I could see the disconnect to what I was saying to how she was feeling. And then when I explored a bit further, I mean, the underlying issue for her anxiety were many social things, but something really basic, like she wasn't sure she had enough to feed her son 3 meals a day. So then it really kind of highlighted the importance of how these things are all interconnected. And just at this point, I thought it would just be useful. I know we're talking about mental health, is just to touch on Maslow's hierarchy of need. So I don't know, Brother Jamal, if you can just pull up that picture so we can just explain that. So I know today we're talking about the mental distress caused by the cost of living crisis, but actually the best way to the most essential way of supporting somebody's mental health is actually by fulfilling those basic needs. So, there's no point talking about counseling and things if people are hungry and cold and they don't have safety and security. So I think we need to just bear that in mind when we're kind of going through the whole discussion today about mental health. It covers the whole spectrum of these things. And as we know, the NHS and primary care is under huge stress at the moment. Staff shortages everywhere, backlogs, up to mountains high. But there are lots of things that healthcare professionals can do to help, and hopefully, inshallah, in the rest of the talk today, we can tease out some of those things and share those things, inshallah.
Amazing, Dr. Siddiqui, Dr. Imran, thank you very much. And just to sort of bear with me 1 second, let me just put myself back on the screen. Okay, fine. So just to welcome everybody else that has just joined us as well. We are joined by Dr. Imrana Siddiqui and Dr. NZF to talk about the mental health crisis in the Muslim community and what we can do about it. So I have experienced a little bit of the problems that are facing our communities. I was made redundant just a couple of years ago during the lockdown. You face a situation like that, you suddenly start to face anxiety, you start to worry about your future. Right now, we have a different kind of problem, the bills, the fuel crisis, the cost of inflation, cost of living, everything is going. Actually, many of us around, whether it's your family members, your friends, your colleagues, you will know somebody through some sort of trouble, some sort of difficulty. In fact, 1 in 4 people will experience a mental health problem in England. Recently, a research was done by Muslims, and Muslims living in the UK are struggling to afford their household bills and have been dependent on a food, according to the Muslims. So clearly there is a little bit of a problem here. Now I want to bring in Dr. Sohail, who became NZF, National Zakat Foundation's one. Prior to this, Dr. Sohail holds a PhD from Oxford University. His PhD thesis, legal epistemology. I don't know if I pronounced that right, but I'll probably get a telling off later on.
It sounds absolutely fine.
For the British Association for Islamic Studies, he has lectured widely on Islamic law, public and traditional settings. In his new role, Dr. Sohail succeeds who led National Zakat Foundation from 2011 to 2021. Welcome, Dr. Everyone can see from the background from Dr. Sohail's library, mashallah. He's very knowledgeable, and he's the man.
You should be working instead of
from an
looking at his
Islamic
books.
perspective, inshallah.
Just one,
Dr.
one
Sohail,
small point.
Thank you. It's an honor having you on this panel of discussion. And Dr. Imrana sort of covered a lot of the medical background problems that she has seen in the community. But what we want to know from you essentially is from NZF's point of view, because I know National Zakat Foundation has been doing a lot of work, and the focus is the UK poverty eradication. And you'll no doubt share with us the Islamic background in the sense that the prophetic tradition, what can we do? So over to you.
Thank you very, very much. Assalamu alaikum wa rahmatullah. Warm welcome to everybody who's made it here. Really small comment, Sultan. It might be me, but every so often you were cutting out. So there could be something on your connection that you might be able to improve. I just wanted to share just a few comments on the topic of Muslims, mental health, poverty, and the work at National Zakat Foundation. Just to say at the beginning, there's a study that recently came out. I'm assuming many of you might have heard of it, which is the Muslim census study that NZF sponsored this survey. They surveyed about 1,500 Muslims across the United Kingdom, across ethnicities, balancing of genders, across age groups, and across income levels. So it was meant to be a representative study. And they asked them a series of questions, and the answers were definitely quite worrying and concerning. What we have about data about the Muslim community, everyone quotes the 2011 census, that the 50% of the Muslim community is technically in poverty, much more impoverished than any other faith community. The new data from the census is coming out soon. But this Muslim census is probably the most detailed, the most recent, and most current. But if you look at it, what it mentions is, for example, 65% of Muslims having had to take out some kind of debt to manage costs and bills. Now, there's two things here, and this is something we have seen at NZF. So there was an application recently from a couple who wanted money to help support running their household, and what they had mentioned in their case notes was that they had been borrowing from friends and family. So you borrow, and then you get stuck in these family debts as a cause of concern. So Muslims borrowing from friends and family definitely is happening. It's happening in this current cost of living. Debt is something, as you know, which creates great anxiety. And so there's something to note. At the same time, there is a positive to this. And the positive is that this idea of borrowing from community is far better than not having anyone to borrow from at all. And the idea of having recourse from friends and family is far superior to having no recourse at all. And so I'm going to come back to this notion of community in just a little bit as an important solution for all of us coming out of this. Really shocking one, also from the Muslim census. It says about a third of Muslims in the UK had to miss a meal in order to afford their bills. It mentions over 75%, it's obviously relevant to today's talk, noted an impact on mental health as a result of the economic crisis. Almost a quarter of Muslims in the UK requested zakat in the last 12 months. 1 in 5 used a food bank. And so this is just something to bear in mind, is that the Muslim community, so the whole idea of faith, and that's what we really give some importance to at NZF, the idea of faith as a gathering point. The 5 pillars of Islam, all of them actually function together to form a notion of community, that faith is family. It crosses ethnicity, it crosses economic standing, and it's an act of choice through which you become family. And so faith as family is something which people have to feel it has consequence, and it's something which results in particular actions. And so the 5 pillars all work in this space. So like the mosque is a space in which everyone is equal. That's it. It creates community, a community of faith. Zakat just furthers that by saying that this community of faith has a duty of care to each other, because faith is like family, and family creates particular responsibilities of care. And so when many of us in this call, when we listen to these statistics, you might feel, well, some of you might feel, you know, people like this, and many of you might feel like, well, your family, your friends, actually, you haven't noticed anything this dire. And that's what the first thing to bear in mind, again, from this notion of faith as family, which is that Muslims are encompass many, many ethnicities in this country, many, many backgrounds, many, many stories. Converts have their own very serious issues when they convert to Islam, of estrangement from family, the need to reestablish themselves, and issues which would border on, you know, issues that will bring about, economic, and related to that, the topic of today, you know, mental health concerns. You've got people, we've got so much in the news of asylum seekers crossing in these very dangerous boats. I met some last year, one of the partners NZF works with, Bradford Foundation Trust. They specialize actually in asylum cases, people who come fresh in the country. And I met some of the cases that they were dealing with and supporting with zakat. Both of the cases I saw were a couple with 2 young children. None of them knew they were crossing a boat. They were made to cross at a knife point, you know, so it wasn't like they're dying to come to England in hook or crook. It wasn't like that. They had a difficult situation. They were told there'll be a better way out, and they were forced to cross in very, very dangerous circumstances. And so a lot of what you're seeing about migrants, a very good proportion of these are Muslims, are alienated, have very little support from government, as has been very much highlighted in the news, very little financial support, can't work, don't get a decision for a very, very long time, and they're just stuck. And so these are people, might not have ever been reached by this Muslim census data, but they're very, very relevant people. Again, at NZF, we deal quite strongly, quite heavily, both through our work and both through our partners with the asylum community as well. And so all I'll say is that the label of Muslim covers a whole host of people coming fresh, fleeing from war, various ethnicities which have made migrations over the last 4, 5, 6 decades, people who've converted to the faith, oftentimes with little support. But this is family now. That's what the whole religion of Islam is about. This is family. Family has to involve care. And that's why this notion of mental health among Muslims has piqued our interest, because it's a concern. All of humanity is brotherhood. Faith is within that, a special tie of brotherhood. And then family is a special tie within that as well. As we'll see in zakat, family has a greater right than non-family. So all of these are ties. All ties are sacred. All ties have to be looked to. So that's all I'll say from that NZF's point of view, that we've seen a huge spike in applications in this last year. We offer people support with direct cash so they can look after their basic needs. We help, and we're probably we are the nation's leader in cash redistribution within the United Kingdom across Muslim and non-Muslim charities. We specialize at NZF at giving people cash. Cash is a growing interest now in charity work. What is what is so important to highlight in cash? It gives people a choice. They can choose what they want. It's a more dignified way of helping someone. And so dignity does fit into this spectrum of how do you find what in that diagram was self-actualization right at the top of the pyramid. We help people with housing. We help people get into work. The last thing I'll say, and I'll hand it back to Sultan, which is that in terms of the next step, where we want to take our work, and we think the community has to take its work, it's in the idea of community, because there's no one charity or one service which is a standalone solution to human beings finding themselves, if that's another way to think about, again, that really excellent pyramid actually that Dr. Imrana shared. It's something which we all have to take a part in. We have to connect all of these dots. Zakat is very interesting because it's a basic pillar, It's a duty of care to people who live where you live, amongst, you know, according to all the classical schools. It's where you live, your right to your community. If we could embed that zakat in mosques, in other forms of the faith and support infrastructure, the hope is that people will get medical help, housing help, will learn about the mosque, will get some cash and find something more than just one-off support, but they find community. If there's anything that's going to move us forwards from these stats I've just shared, and broader stats from the non-Muslim community in the UK, it's a very difficult time in general. What moves us forward is community, investing in each other, investing in how we can hold hands, connect dots to offer a real net of support for each of us. I'll hand it back to Sultan for now.
Thank you very much, Jazakumullah khair, for that beautiful spotlight on NZF's work. And hopefully we'll get to explore a little bit more about what support is available. But before that, I want to go back to both of you, Dr. Imran and Dr. Sohail, about what kind of support is available. So let's say many of us, I mean, I've just gone through the list of participants. There are many Muslims there. Some of our participants might not necessarily be Muslims. So just holistically speaking, if someone was going through a mental health difficulty right now, let's say if they're going through anxiety, depression, or just struggling to wake up and seeing, you know, the bright future in front of them, and they're feeling a big weight on their shoulders, where do they go? What kind of support is available for them at the moment? Let's start off with Dr. Imrana. From a GP perspective, what can you share with our participants if they're going through difficulties and not necessarily diagnosed with depression or anything? Because I know that's sometimes a bit of a taboo topic. You know, you don't want to be tagged with that label that, oh, you suffer from depression, you have to be on medication, or whatever it may be. So at what point do we seek professional medical advice?
Jazakallah khair, Brother Sultan. I think there's a few questions rolled into one in that one. But I would say, kind of in an ideal world, I think wherever you seek help, it should lead you to the right support. So kind of what we call in medical terms or healthcare terms is a, you know, single front door, or a single point of access. But talking more specifically about health in terms of healthcare, so the kind of scenario that you described will, you know, you definitely say, you know, please do come to your GP. You know, we're primary care providers. I know sometimes it's difficult to make those appointments, but what we have within our surgeries now is a wider range of staff, and including within those are social prescribers. So I think most what we call primary care networks. So most groups of GPs should have somebody linked to them who's called a social prescribing link worker, and they can help support our patients with their social needs and embed them within the community. So that's a really important resource that we have. I mean, more specifically, for there are lots of things actually people aren't aware about. Very simply, like with healthcare costs and prescription costs, there is an NHS scheme that you can apply for a certificate if you earn less than a certain amount, and then you get a card which gives you exemption for certain medications. But I think the key again is it's that coordination. So kind of, you know, within the clinical lead that I wear within our area, so kind of working within boroughs, so within our council, our public health team are coordinating the response, because as I think Brother Dr. Sohail mentioned, there's lots of great work happening out there, but it's just about how we coordinate that. So for example, in Newham we have an anti-poverty alliance, and that's coordinated by the council, but it's a range of voluntary sector organizations. So I think the key is one is that it's the coordination of the support that's available, and secondly is to seek help if you need it. So as Brother Sultan, you mentioned, there is that stigma with mental health, and also particularly there's actually a universal stigma with poverty, and so poverty related mental health is kind of like a double whammy. So do seek help if you need it, because there is support out there. And this, if I hand back, there's a third point I just wanted to make, which is a slight maybe a slight tangent to what you were asking, but in terms of support, often we think about what are the physical things we can give. You know, can we give? Do we have money to give? Do we have time to give? But there's also something else, which is what we do in the connection that we make. And in kind of medical terms now at the moment, it's termed as a trauma-informed approach. And I've just got a slide up just so people who are aware of it know some of the kind of principles regarding it. But what that means is that irrespective of where you are within the system, if you're a professional, if you're a friend, if you're, you know, I've seen some people in the group, if you're an accountant and you've got kind of a struggling small business owner coming to you, the way that you deal with that person by making them feel valued, by listening to them, by providing a safe place for them to talk, that in itself is therapeutic. So I think that's an important aspect to remember, as well as kind of the physical help, is that kind of the way that you deal with people can actually be a form of therapy. I'll hand back to you now, Sultan, just a second.
Thank you very much, Dr. Imran. I was just writing some notes as you were speaking there. I find it really, really engaging. So what I took from that is there are two-pronged approach. So one is, if you are facing difficulties, then definitely approach a GP, definitely approach the medical professionals so that you can get the sort of right support at the right time. The other point is, a lot of professionals that are out there, whether you're an accountant or a fellow doctor, or you're in a profession where you come across people and they might share their difficulties with you, don't just sit back and think, okay, it's not my problem. They will have to deal with that by themselves. So offer that support. And the slide that Dr. Imrana shared, very, very insightful. And I'm sure we can share that if anyone's interested. Right, before I put my next question to Dr. Sohail, just as a reminder for everyone that's joined us on this Zoom call, I know many of you might have questions. Please write them down. And in a short while, in about 10-15 minutes, we'll give you an opportunity to put your questions to Dr. Imrana as well as Dr. Sohail. So please make sure that you are asking those questions. And you can, if you want to, just type in your questions in the comment box. So please do that, and we will go through those questions and pick out a few towards the end, inshallah ta'ala. Now, Dr. Sohail, as the CEO of National Zakat Foundation, my question to you would be, what kind of support would be available to the community out there? I mean, who does NZF essentially support? Is it a Muslim-only organization that supports people that are struggling? Because I know I read a story on Twitter, a 27-year-old mother who was struggling with her debts, and she's been in court. You know, sometimes when debt accumulates, it just goes from bad to worse, and you're scared of opening letters, and you don't want to know what the next letter is going to say. So that leads you to take drastic action, and sometimes that is to stand in front of a train because you just think you're no good to anybody in this world. So as NZF, as National Zakat Foundation, what support is there for people that are going through those difficulties? Dr. Sohail, you're on mute. If you don't mind unmuting yourself, please.
Thank you very, very much. But I'll try it without the mic on, then I'll try it again with the mic activated. Just a couple of things again. So National Zakat Foundation, we specialize in distributing zakat within the United Kingdom. This is based on, as I hinted at earlier, teachings which all the classical schools of law agree upon, which is that zakat is meant to be spent in the place where you live. Reason being, as I hinted at also earlier, that zakat is meant to create within us a sense of responsibility and a real tie of connection with the family of faith where we are, so that over time you live within real community, because you develop it as a duty of this pillar of Islam. And so what we're trying to do going forwards at National Zakat Foundation is to really find a way to embed our zakat work within real communities. And so we already have started doing this. We have a partner mosque in East London, in Barking, where people can go there, have a short assessment, have some immediate cash support, but in the process, get to know the other services within the mosque. And so what that leads to is other forms of help. They might find, in one case, a lady came looking for zakat money. she shared her immediate needs with the people at the mosque that already is having someone to talk to. And then they found out that she also has teenage children, doesn't know what to do with them. So they gave her free martial arts classes for the children in the mosque, or they might give a free Quran class, or they might be able to link them to other council support for housing. So the idea is, as I was hinting at earlier, if we can embed our support within our community faith infrastructure, then people find something they can go back to again and again. They find community, they find belonging. Another partner we work with is in Bradford. They specialize in supporting the asylum community. And again, these are people who've literally don't know English, many of them, don't have family, many of them, don't know anybody, stuck in a hotel with their kids, don't have any money as well. So you can imagine the feeling of finding something when you can walk into a center, they welcome you through your faith, they offer you simple things like prayer mats and other things, but the idea is you found something similar, you found family. They have a translator, because many of these might be Arabic speakers. They get invited again to a family coffee evening so they can get to know other families who are like them. This is the idea that zakat is a mover and a connector so people can find belonging. People can find that if I'm a Muslim, there's someone there for me, and that someone is near me. That's it. This is an important movement to addressing this idea of alienation, which is very much connected to this, to the notion of, it makes the mental health so, this financial crisis and other things so much more difficult to bear when you feel alone. As far as the other work that NZF does, before I hand this back to Sultan, we offer support online. And again, like I said, we're probably the nation's leader in cash distribution across the United Kingdom. You could be anywhere in the UK. You could apply online for support, and you can be given, again, there'll be a check, an application and check just to make sure that the payment is suitable. But you can get a cash payment based on your family size through a bank transfer. If you don't have a bank account, you can get it at any near post office to you. Same with housing support. You can get support for rent arrears, rent deposit, council tax, basic furniture, again, wherever you are in the United Kingdom. We also offer support with work. If you need to take a course of training to get into employment. And so I'm currently speaking with people who specialize with people in prison, and they're giving them support services before they get out. So we're discussing maybe there's a course of employment they can do almost within prison, so they can come out and they have something to stand on their own 2 feet as well once they come out. And we also offer support with education as well. And so the current support is available. It's across the UK. It can be accessed online. We have ways to get the support to you. In terms of this, I really appreciated that Maslow's hierarchy of needs was very suitable. That you have to take care of what's on the bottom to have a chance to take care of what's on top. And so a lot of this support, the work, the cash, the food, the clothing, it is essential. But then what comes on top of that is about belonging. And just the fact of getting supported through faith gives a sense of belonging. So we ask people, do you feel closer to the Muslim community by receiving this support? Do you feel your faith has been boosted by receiving the support? And overwhelmingly, the answer is yes. Even through the internet, there's an idea of, I had a family there for me. I wasn't alone. And then if we can embed it within community, then even more so. Back to your very first question. Yes, zakat is not Muslim charity in general, which is something that the Quran and Sunnah emphasize an incredibly great deal, but it's a subset of Muslim charity, which is a duty every year for those who have towards other Muslims, especially those who live near them. And the point of this zakat is it purifies the wealth of the giver, and it forges a strong tie of connection within this family of faith, so that people feel brotherhood is not a lip service, it's real. Faith has brought connection, family, and belonging. And so that's the work that we do.
Fantastic. Jazakumullah khair. Thank you very much, Dr. Sohail. Now, moving on to some of the questions. I think one question I'm going to allow this question to jump queue. Someone that's watching us has asked, Assalam, can you please say the name again in Bradford so I can help them with my time? Dr. Sohail, I think this you mentioned the organization name in Bradford. Could you just remind our viewers the name of it so they can go and help with their time, please?
Yeah, sure. It's called the Bradford Foundation Trust. I visited them in Bradford back in November. They're next to a mosque you might be aware of called Islam Bradford. So if you know that mosque, they're right next to it. It's called Bradford Foundation Trust.
Fantastic. Jazakumullah khair. I hope that was useful. And the rest of the questions, mashallah, the questions are coming thick and fast, which is great. We want, more questions. The more the questions, the better, because we want this to be an interactive session where all of you are able to interact with Dr. Imrana as well as Dr. Sohail from the charity's perspective. So you may be someone that is looking for support. You may be someone that comes across people that are looking for support. And I know there is a beautiful question coming later on as well about someone like an accountant who is able to point people towards particular signposting towards particular support areas. So whatever your case is, please don't be shy. You don't have to disclose your name. I'm not going to mention anyone's names when I'm asking those questions. So this is going to be completely discreet, completely confidential. So please feel free to post those questions privately to the mediator, which is NZF. There's an account called NZF. You can send that question directly to NZF, and our brother Jamal, he is going to send the question over to us to be asked to the panels, inshallah ta'ala. Right. The next topic that I wanted to bring to the panel, Dr. Imrana, as well as Dr. Sohail, is issues specifically facing the Muslim community that are not particularly the help is not particularly available to sort of in a what's that word I'm looking for, in the mainstream. So sometimes we see that the support that is available is simply not enough. So someone might get income support, housing benefit, and all the other support mechanisms that are available because of inflation. Already we know people are spending very little. And some of you might have watched TV programs and documentaries where rich people go to poor people's house and understand how they live. And often they would put the bills and rents and everything else on top. And by the time they've got whatever little left, they're having to ration that and choose whether they're going to buy a full meal or they're going to skip meals. This is the difficulties that are facing our communities. So Dr. Imrana, in your experience as a GP, and of course you're a Muslim GP, and you could probably advise us on this, is there an area where you can identify specifically for the Muslim community where they're not able to get that support anywhere else, and you can signpost to them through the NHS or any other areas where they can reach out to receive that help?
Yeah, Jazakallah for that question. I mean, I think there's one kind of, I guess, main thing is that the impact on Muslims is the disproportionality of it, is the fact that the Muslim populations, as Dr. Sohail very clearly outlined, although they're heterogeneous, they are disproportionately affected, and hence that's where the difficulty comes. And I think I mentioned before, it's the universal stigma of poverty, plus the stigma associated with mental health in many of the cultural communities that many British Muslims come from. It's both of those together which can make it more difficult to seek help. In terms of barriers, as I think Dr. Sohail already mentioned, those particularly asylum seekers. I in UM see lots and lots of patients with no recourse to public funds, those whose immigration status are in limbo, so they can't work. So those things, obviously patients struggle with. The other thing I think also important to mention is that for those who are involved in designing healthcare, there is an acknowledgement that healthcare has to be tailored to the cultural needs of the population, otherwise it's not as effective. So there is that acknowledgement out there, and I think people should feel empowered that the care that you're given should be appropriate and culturally appropriate and relevant to you. So Yeah, so for example, if I refer to, you know, the generic services, you know, be it talking therapies, I think somebody mentioned in the chat as well, who I work very closely with, they should offer you something tailored if that's what you need. And just on that point, perhaps I'll pop it in the chat later. There's it's London-based. There's a London-based NHS digital support for mental health, and we've worked with them to design resources which are through a faith lens. So you'll have all, if I'll pop it on there later. So it's kind of NHS advice, but it's tailored for different faith lenses, and it was piloted actually in Newham for the Muslim community, and because it was so impactful, they've done it for, I think, 7 different faiths within that website. So I think, yeah, I think it's, you know, it's the barriers of the stigma, but also just being aware that the healthcare providers, whoever they are, should meet the needs that you have individually. I hope that helps to answer that question.
Yeah, perfect. Jazakumullah khair. Thank you very much, Dr. Imrana. So the other question I've got for Dr. Sohail is, from an Islamic perspective, the prophetic approach to mental health, because I know in your both of you have shared some very, very good insights. But from an Islamic perspective, Dr. Sohail, what is the prophetic approach to mental health issues? Because I know that there are misconceptions in the community, and I've heard that, you know, some people even have this belief that it's haram to be depressed in Islam, for example. Misconceptions like that. You have to have faith in Allah, and because you're a Muslim and you have taqwa, you can't be depressed. You can't lose hope in life. And I know as human beings, we are weak, and everybody has a different struggle. Not everyone is as strong as to think that, you know, I'm going to have faith in Allah and everything is going to be fine. So Dr. Sohail, from your perspective, I just wanted you to touch on this from an Islamic perspective. What can you share with us on that note?
Yeah, thank you very much. I mean, this is I definitely want to also shoot this back to Dr. Imran after I say a few points, because I think maybe this is more up her alley in many ways. It's hard to say there is such a thing as a definitive Muslim version on mental health. And I think scholars are quick to point out that mental health problems are real. And if people have mental health issues, then there are experts, and there's a science, and there's medication, and there's nothing wrong with seeking these out where these might help. And so I've just to say that. Otherwise, once we leave this aside, in general, we all know there's a growth in mental health concerns in this in this recent period, in the last few decades. And we all know that we're going through a very strange time as human beings in society. We all know that the last 100 years has marked the lessening of faith in many ways in public discourse. We know that the absence of faith can lead to various forms of angst, you might call existential angst, and other kinds of angst in terms of what is all of this about, and losing anchors when things go quite difficult. We also find in these last few decades a way of living in which we are alienated from each other through technology, through small families, through a very strange rat race. We can't put our finger on why we always run out of time. And that's tied to economics as well. We have an economic system which has been over the last 100 years, really dominated how we live, a system which is based on debt, interest, and therefore, as time goes on, it's so difficult just to have shelter in a way that it makes no sense, actually, how expensive it is to have shelter. And so there's a compounding of factors, all of which are the factors of modernity, a very unique, you could say, anti-religious economic system, because all traditional religions were against usury and interest, which is exploitative in its core. That's led to a very particular forms of work, of alienation, of non-extended families, of lessening of faith. So what I'm trying to get at is it's quite natural that people should feel alone, not connected, different kinds of angst. And all I will say is faith in its global message, is important. Faith in its social message, faith in its economic message, faith in its charitable message, and faith in its meaning, that the world has meaning, that God is good, that there is purpose, that your lot in your hand isn't bad. These are all important. So all I will say is faith in general is needed. It has a lot to offer. The Islamic faith is a very rich tradition of rules, teachings, laws, and values. At the same time, mental health is real. Mental health problems are real, and people shouldn't be discouraged from seeking out solutions and speaking with specialists where these are relevant and needed. But that's where I think Dr. Imrana is more capable now, if you want to add something.
Jazakumullah khair. Thank you. And yes, I would like to bring Dr. Imrana on that note. And just to also share, Sister Layla has rightfully said that Prophet Muhammad SAW himself has experienced low moods, as the Surah Al-Duha was revealed when he didn't receive revelation for a long time. So rightfully reminded us. So Dr. Imrana, coming back to you, what is, from your perspective as a GP, but also from your knowledge, the perspective that you can share with us, the Islamic perspective to mental health?
Jazakallah khair. I think a lot of what I was going to say, Dr. Sohail has covered. So I think, I think in a more articulate way than myself. The only thing I would like to add really is that there doesn't have to be one or the other. So it's not like you can only seek, Western medical help or go down a faith route. There's this whole kind of new concept in Western healthcare is about personalized care, and that's a more holistic view on things, and definitely kind of within the faith framework. Again, this is a topic for another day, but the Islamic psychology has got such a rich and deep history, and there's so much from modern medicine to learn from it, that that clearly that there's an understanding of mental health issues. And just on that note, perhaps I'll share a resource that I helped to develop with this good thinking mental health resource regarding it was basically a mythbuster, but it was kind of fact checking common misconceptions within cultural communities that many of British Muslims are from, and kind of fact checking that with what the Quran and Sunnah says. And as we people are saying on the chat as well, that definitely it's not something that's linked to low iman, and you can have these health conditions, including mental health conditions, and actually again, this is a slight divergent to your question, but actually until very recently there was a very medical model of what depression is, of the clinical diagnosis of depression. And over the last few decades there's been more understanding about the biopsychosocial model in terms of symptoms, but in terms of treatments the offers have been quite medical up till now. But even now, within kind of a nice guidelines which has been updated last year, there's more emphasis on personalized care, and so what that means for the patient, and that's if that's a spiritual angle or a faith angle, then that has to be incorporated.
Perfect. Okay, awesome. I'm conscious that we've got quite a lot of Q&As, so our viewers, participants have a lot of questions that need answering. So I'm going to just target one last thing, and this question is going to be to both Dr. Imrana and Dr. Sohail, is how to encourage positive attitudes regarding mental health. I know you might have touched upon it through the words that you have shared with us beforehand, but in a nutshell, how would you encourage positive attitudes? Someone might be feeling a little bit down. Someone might have been feeling down for a long time, and knowing what's coming in the future, they might be struggling, or they are going to struggle, and they know that's giving them anxiety. How should we change our approach to develop positive attitudes? Dr. Sohail.
Yeah, I think the main thing to add in terms of just, again, the most basic faith framing is it goes back to, in the Islamic sacred law, the extreme importance given to community. All of it, all of the sacred law is about people coming together. And so what you have to understand is that the Sunnah, when it comes to thinking of what is the best thing you could do with your time, just giving time to a human being, giving importance to people's feelings, hearts, souls. We are not all of us counselors, and we are not all of us trained or expertise, but we can all be human. We all have the ability to show people it's all right. I can listen. Let's talk. Why don't you come over? Why don't you share a meal with me? Let's watch the football together. It's the idea is that we might not all be experts, but we all can appreciate the sanctity of the human heart. And if you read the hadiths of the Prophet ﷺ, there's so much emphasis on this, so much emphasis on making up between people, that broken relationships, try your best to heal them. The broken heart, the sad heart, the hadith said, protect yourself from the hellfire, even if only with half of a date. And if you cannot, then with a goodly word. The idea is, you're eating a date, you've eaten half, there's half left. Someone is there, why don't you gift it to them? That's it. That gift, that's an act of connection. That will save you. If you can't do that, say something nice to somebody. You're looking really good today. That can give somebody a very, very good day. You can talk about, so all I will say is my examples are very simple. But the point I just wish to state is there's very little things you can do with your time that are more valuable than giving another human being importance and giving their problems importance and giving people time. And I just think that's something we all should be able to take on. It's not complicated. And you should never feel that you wasted a day in another person. That's a day that you've spent well. If I hand over Dr. Imrana, also maybe there's more detailed things that you could add.
Thank you. Dr. Imran, over to you.
Jazakallah khair. No, I mean, I think Dr. Sohail has said really the same things that I was going to say. I think this whole topic is actually can be quite depressing, but again, it's that message of hope. And there's kind of three things I would say, and I think, just to echo what Dr. Sohail has said, is that those simple things are as important as ever, if not more now in these harder times. I'll kind of link this back to NHS. So NHS has kind of a 5 ways of well-being, and that's about and there's lots of resources linked to that. But again, those are about those really simple things, about connecting with other people, about giving to people, about exercising, about connecting to God. So these the things that I think Brother Dr. Sohail has already mentioned. So just doing those simple things, implementing those in your own life, can be very powerful. And the other thing is, again, whatever role you do, you can make a difference. And again, it's that using that trauma-informed approach, which I mentioned earlier. And as Dr. Sohail so amazingly linked, that this is the prophetic way, subhanAllah. And thirdly, that nobody should face it alone. Again, it's that sense of community. There is support out there, and so if you need it, don't feel kind of stigmatized that you can't get that support.
Okay, Jazakumullah khair. Thank you very much. Let me bring in the Q&As now, and I know many of our participants have a lot of questions. So we are 1 minute left to go till this session finishes. So what I'm going to do, if Dr. Sohail and Dr. Imrana, if you're okay with extending the time, maybe another 5-7 minutes,
Yeah, sure.
so we can go through some of the questions. This is one of the early questions. As an accountant with a client who is struggling, apart from lending an ear, we will refer for tax credits if they're eligible to NZF, who can possibly help. Dr. Sohail.
I would say certainly. I mean, if they are, again, our support at NZF is A, for Muslims, and B, for Muslims who are, you could say, financially struggling. So if this applies to your client, then I think definitely you can let them know about NZF services and support. And if you have the time, inclination, ability, and if they struggle, yes, you could actually help them get started on the application, because not all people can do an online application easily. It's a sort of barrier as well we're trying to overcome by working with partners. There's a sort of barrier to online applications in general. So I would say definitely, I think it would be a good move if they're eligible for the support.
Perfect, shukran. Second question, Salams, what about signposting them to claiming PIP benefits? PIP stands for Personal Independence Payments, I think. If they're eligible, this process is now very long. So, Dr. Sohail, Dr. Imran, I think I'll go to Dr. Imran first. What about signposting them to claiming PIP benefits if they're eligible?
Yeah, absolutely. There are lots of different mechanisms of support. So if they are eligible, then absolutely we should kind of encourage people to claim what's available for them. And so within our practices, we have our social prescribers who can kind of take that detailed history and signpost and support with what they need, what's needed. If it's, you know, PIP or there's various other kind of streams of support, it's out there. So yeah, absolutely should be used.
Okay, perfect. Dr. Sohail, anything you want to add on to that? Yeah, I think all I'll say is the answer always has to be an unconditional yes in all of these cases. Many of these forms of support are slow. Sadly, NZF as well, and some of our funds, because in this summertime, had a lot of people applying. We also will have our backlogs in a seasonal way. That's why, again, if we can find ways to embed support within community, there's always will be forms of support people can tap into. But what I mean to say is there might be slowness at NZF in seasons. There could be slowness with the benefit system. But what we need to do is just get people in. And so if you can apply, if you can signpost, if you have time to actually help someone make these applications, it's a huge boost for people who struggle with these kinds of forms. And the hope is once they're in the system, the help will come. It just the waiting game is an unfortunate thing with public services. Yeah, perfect. And there's also the Citizens Advice Bureau. If anyone needs that support, you can always go to Citizens Advice, and they have experts. They can point you to the right direction as well. The third question: what about the IAPT service? The waiting list is very long. IAPT stands for Improving Access to Psychological Therapies. Is that right, Dr. Imran? Did I get that right? Okay. So what about the waiting list? Some say that the waiting list is very long, and there must be a group forum locally to engage and feel connected with Muslims.
No, absolutely, I agree. I mean, I work very closely with that IAPT, and Brother Sultan, I'm very impressed that you know what that acronym stands for. But for often people refer to it as their local talking therapy service. So I think there's a few things. One is empowering the patients to be able to take some of that autonomy in terms of there's lots of digital resources out there to help with people's mental health, and so while people are waiting, there's no reason why we can't signpost to those. And again, I've mentioned good thinking already, and that's something that we do. Having said that, waiting lists are a priority within healthcare services to get reduced, and actually within Newham, I hate to brag, but within our patients get an assessment within 7 days. And so I think thinking that there's going to be a waiting list, don't let that be a barrier, because sometimes there isn't. And if they have, and so just again get people into the system, and then use digital resources. Again, that's some of the work I'm doing, is how effective is digital resources compared to face-to-face. And so if looking at the effectiveness of that, and if it is as effective, then that's something that would hopefully be rolled out more extensively in the future.
Perfect. Jazakumullah khair. Thank you. So the IAPT services, is that something that people can go to directly, or is it a referral through a GP?
So I think really important for people to know, it's often people come via their GP, but it's a self-referral, I think, in all parts of the country.
Okay. Right. Yeah. Just thought I'd clear that up for anyone that's watching. Right. Next question is actually a very interesting one. Is NZF going to consider microfinancing? Microfinancing, for those of you who don't know, is almost like an interest-free loan. If people are struggling, they need an immediate, or if they have a business idea or something that they can generate income with, they can access some financing, which they will pay back without any interest. Is NZF going to consider that? The questioner, I'm not going to disclose the name, but he or she said, I know of Lend with Care and Kiva, and I wish there was something like that run by National Zakat Foundation. Dr. Sohail.
No, thank you for raising the institutions. Maybe we can do signposting. So we specialize in zakat, and the issue with zakat is the right of the recipient. So we can never make a zakat payment and say, thanks, now can we have it back, please? Now, many recipients do have a commitment, like quite literally, again, our partner in Barking, he mentioned there was a homeless gentleman they found, they gave them a cash grant, not a huge one, but just to get the person started. And he, with very great seriousness, said, my intention is to pay you back. That's not because it's a loan. It's because there's the idea that zakat is like a public fund. You've received it now, and the hope is that people will start earning and pay back. Many make such a comment because it softens the, if I could call it a blow of being the recipient of charity. For many people, it's like a blow because you've tried to stay at a particular level of self-sufficiency, and you've fallen now into asking. How do you soften that for yourself? Is you make a commitment, say, I'm going to pay this back. But the bottom line is that's if you do pay it back, it's not paying back to any person. The zakat is yours. It's your right. It can never become a loan. No one can ever stipulate anything on your zakat. So that's the only thing that microfinancing is a different kind of support. But in the spirit of what I've been saying today about networking, connecting these nodes of support, it would be excellent if we could also signpost people to microfinancing. And so I'll make a note of, you've mentioned Lend with Care. I'll have to say, I didn't catch the other name. Is it written here somewhere?
Yeah, the other name is Kiva, Kiva.
Okay. No,
Yeah,
good.
but yeah, I mean, it might be something that, Brother Sohail, that you might consider doing, set up by NZF maybe, but not specifically to do with zakat. So, I mean, it's a very good point actually. Because I've been working in the charity sector for the last 15 years, and in international charities, for example, in Bangladesh, in Pakistan, microfinancing is widely used by charities to take people out of the cycle of poverty. But in the UK, I haven't seen it myself. So I think that's a very, very good proposal that if we can look into it. Of course, there are always challenges with these sort of things, but I think it's very good. Swiftly moving on. The next question. Okay, we should do rich people, poor people, a Muslim version. So we can show how some manage their budget. Example, prioritizing minimalism, spending mindfully, and avoiding the trap of Black Friday sales, Christmas sales, Boxing Day sales, etc., etc., etc. I think that's something for me to take note of. Inshallah, I will suggest that to maybe Islam channel or one of the TV channels and see if we can take that on.
You'd be the best host for this.
I will invite someone to come to my house. That's a rich person to come to my house, and they can look at the way I live. Mashallah.
One thing I'll add, though, which is really curious, is that it's quite difficult. So we do ask people for bank statements and just to make a sort of finance check. But what makes it very tricky is, again, within the zakat framing, if you think about zakat now, a person has a right to support if they're struggling, and they have the right not to be judged as well. People coming in telling them how to live their lives as part of the dignity of this exchange. It's very difficult for a grants officer seeing someone else's bank statement. And so we have to come up with some guidelines on that. And why am I giving this example? People who are new to the country, we've seen this. They sometimes spend money on taxis because that's what you do back in Syria and wherever. Whereas we over here, we never use taxis. Okay, maybe Uber is now a cheap version. But the point is we use public transport. Someone who's new here won't understand how to use public transport. So it is sometimes that people who are not well-to-do don't always know how to cut corners on very, very basic things that we would, or they might not know for a long time what the difference between Aldi and Waitrose, for example. And so there's very little, so you might be surprised in rich people, poor people. It might be the poor people, depending on, again, I'm talking about the asylum case, but they might actually be spending money in ways that we might not even consider responsible, but that's because they just don't understand yet how many of these systems work.
Yeah, no, I think the other thing is the element of dignity. Many people that face challenges like that, they might not necessarily want others to know. And I certainly know that within our communities, there are people that they are looked up to in the sense that they might look very successful, but inside they're going through so many different challenges, whether they've got big debt or whatever it is, and not everyone is going to be very comfortable sharing those. So yeah, definitely a good idea, but a very challenging one. But I think that's something for us to take away and to talk to the media companies to see if that's possible. Right, moving on. For those in South London, we are currently in the process of setting up a wellbeing hub, which is integrated within the NHS Mental Health Transformation Board. This is part of our wider ethnicity, mental health and improvement program, which takes structural inequality, especially within the BME communities. We have one hub based within the Black African Caribbean community, and this new hub is based around South Asian and Muslim communities within Southwest London, mostly the Wandsworth area. This will be culturally adapted, and we will have a range of different community spaces included, like a domiciliary care provider, mosques, foods, and food banks. We have trained community-based faith leaders like imams in systematic family therapy to provide early intervention in mental health support. Okay, so I'm assuming that there was no question at the end of this, but this is something, an example of great work that's being done in the South London community, where perhaps we can use that as an example going forward. If you are part of a community which is very influential, maybe you can take this example and see if you can set up a hub like that. Dr. Imrana, do you want to come in onto this?
Yeah, just to add, it sounds like great work. We're going through a mental health transformation within North East London as well, with these similar priorities. So I'm happy to link up. I think somebody did ask for my email address, so I will put that in the chat. So I think it was Sister Anissa. So happy to link up and share, inshallah.
Perfect. Jazakumullah khair. Right. The next question: there needs to be a support system in place for Muslim women who leave their family homes with children for whatever reason, and that they may need. That's a lot of pressure, especially from a physical as well as a mental health perspective, and at times a lot of trauma. I'm glad you brought this issue up, because my wife works for the East London Mosque and she comes across a lot of these cases, and I hear about it a lot. And having worked for Islamic Relief and Muslim Aid, we have seen a lot of women, especially from our Muslim community, because of the taboo topic within our communities. They often don't know where to go, and when they approach mosques and institutions that they can trust, often they're under-resourced, so they don't have the necessary support. Dr. Imrana and Dr. Sohail, this probably I'm going to put to both of you in terms of what support is available for Muslim women specifically.
I'll just
Dr.
say
Sohail,
a little bit
since
of
you're
our
unmuted,
history.
do you want to kick off?
Yeah, I'll say a little bit, but again, I'd like to hear Dr. Imrana's point. All I'll say is that NZF actually started with sheltering projects for Muslim women who were victims of domestic violence. There were 3 shelters. We were subsidizing actually another provider called St. Mungo's for the Muslim women residents, who they would give them casework and support and so on. But I'm not aware right now of a functioning Muslim women shelter, but I'm sure there is as well. But I don't have a name right now to offer. I don't know if Dr. Imrana has.
Dr. Imrana? Yeah, just again on that direct question about a specific shelter for Muslim women specifically. Again, I couldn't give you a name at the moment, although I think it sounds like I have heard of them in the past previously. I know there's the there's few specifically for different ethnic communities, including Pakistani and Bangladeshi, where a lot of our Muslim communities come from. But I think on a wider point, I think the highlighting the plight of single mothers is definitely a vulnerable group. And I was at a cost of living webinar last week, and this was raised as well. So this is a clearly a vulnerable group that do need support. And just again to highlight is that even within mainstream services, people should feel empowered to have care that is tailored to to their, what their needs are. So if you're a Muslim and you've gone to kind of a generic shelter, then again there shouldn't be any shyness about this is what our needs are.
Great stuff, Jazakumullah khair. Thank you, Dr. Imrana. Let's move on to the next question. There are a lot of different community organizations doing a lot of different and meaningful work, but we need to find a way to collate all of these services together. Perhaps we may need a centralized directory of Muslim-based resources and services that are available across the country. Dr. Sohail, what do you have to say?
No, just to say, yes, I think you're absolutely right. There needs to be a centralized repository of support, I think, for Muslims. This is on the one hand. On the other hand, I think it's important, Dr. Imrana, mentioned it as well, that there shouldn't be shyness to use, obviously, non-Muslim services as well. I mean, at the end of the day, what's going to be happening now, it started in the pandemic and it's going to continue into cost of living. It's just what I call simply the rise of community in general. Government is not keeping up and is not catching everyone. In the pandemic, churches, mosques, faith institutions in general have been very important sources of support. And then faith charities. So, for example, Trussell Trust is a food bank service connected to the Church of England. And so there's just a lot of services. We need to make sure that people know what they are. And the trick of all of this, as Dr. Imrana said, is helping people overcome the stigma of seeking support. And so one is the directory then of Muslim services, but one is just the directory of what a person has access to in a particular area. And they might be very unique, very specific to that case, that person, that demographic. And they might not all be Muslim, but again, that's not a reason to not partake in this. And we should make sure that we make people aware.
Perfect. Dr. Imrana?
Yeah, I agree with everything above. And just to say, kind of in healthcare, it's what's it called, an old chestnut, where but having all the right resources in the right place. But again, it's about how to keep it updated, ongoing challenges. But there are lots of things coming out, and I would say again, it's fascinating actually that what Dr. Sohail has linked that kind of community-based to such a strong faith link, because the way that I think one of the sisters mentioned in the chat about the mental health transformation, this whole kind of new way of healthcare is about building community assets within neighborhoods and healthcare within neighborhoods. So this is all kind of fits in with that same model. So I would say yes, I think definitely there is a need for both, generic and for Muslim specific resources. Just to add on that as well, and I think to hopefully will cover some of the questions already asked in the chat. Somebody mentioned Sukoon, somebody mentioned Muslim Mindworks UK. So BIMA is part of an alliance called Muslim Mental Health Alliance, and that's it's an umbrella organization of alliance, rather, not an organization, of these two that you mentioned, as well as a few other organizations who work specifically with Muslim mental health. So there is that out there. Again, it's in its infancy, but it's something coming. And then the other thing I would say, just generally, there's lots of intel in the grassroots. So I think wherever you are, if you seek help in your local area, you hopefully should find things. But I totally agree. I think having easy access to what's out there is a dream.
And I know National Zakat Foundation, on your website, you have a signposting service there as well. So if anyone wants to get specific information, you can always go to the NZF website. But yeah, something definitely that's worth. I mean, we used to have the MD UK, Muslim Director UK, that used to have a lot of information. So yeah, definitely there's a gap in the market there for us to be able to input into. I don't know if we have any more questions. If anyone has any last question, please pop it in the message box now. If not, I think we've covered quite a lot of area, and I think we've gone over time by 20 minutes as well. So I'm conscious that I don't want to take too much of our panelists' time as well as our participants' time. But there's some comments. Bal from the Children's Society has commented that it's been really interesting hearing all the examples, and from someone also, mentioned that Mindworks UK is also an excellent service, providing very low cost therapy and counseling service if anyone needs it. So clearly a lot of, mashallah, a lot of people have a lot of knowledge, and it will be good for us all to work together. And Dr. Imrana from BIMA, as well as from the NHS, from your perspective, there is clearly a wealth of knowledge available to us, whether we're Muslims or from other faith groups. There is clearly something for everybody, and it's just about making that accessible to people when they need it. Another thing I take away from this, Dr. Imrana, when the chart that you mentioned, that it doesn't necessarily have to be, if I don't face the problems, then I'm okay, and the community can go to the NHS. There's a hadith where Abu Bakr radiallahu anhu once shared an ayah of the Quran, where he was quite disappointed with the Sahabas that they were misinterpreting the ayah of the Quran, when Allah subhanahu wa ta'ala says that if you have abided by the laws of Islam, and if you have followed the commandments of Allah subhanahu wa ta'ala, and you are on the straight path, then you'll be fine. And that was misinterpreted in the sense that, yeah, I'm praying 5 times a day, I'm doing my bit, I'm fine. But the emphasis on that, Abu Bakr radiallahu anhu mentioned, is that we have to be accountable for the wider community as well. So if we see evil, if we see bad, if we see that people are struggling, we cannot sit back and pretend that nothing is happening. We cannot sit back and pretend that everything is okay, because as human beings, as Muslims, as people of different faith groups, we are all one community. And this is why it makes it so beautiful that when we stand up for one another, we are much more powerful and we can help each other out. And this is where Dr. Sohail, also you mentioned this particularly in your speech, that when we are united together in a group, rather than suffering alone, suffering in silence, it becomes much easier to deal with our issues. So thank you very much, Dr. Sohail and Dr. Imrana. I want to allow you to share your final words before we conclude this session. So maybe perhaps we can start with Dr. Sohail. Your final words to the participants on this panel tonight.
Just want to say thank you all very, very much. I really appreciated, learnt a lot from the questions. Just my own thanks to Dr. Imrana. Really appreciated her, also her contributions and frameworks. I've written down a number of names of the organizations that you've mentioned. I think the themes I've raised, I've probably over-repeated myself, but what's really important to me is this idea of connecting, community, care, the idea of zakat as a foundational duty that we owe to our neighbor in faith is something really important. And there's nothing in what I've said that I hope should be taken as de-emphasizing or under-emphasizing the struggles of people overseas. All struggles are important. But it's just, there is a right that our neighbor down the road has, who might be struggling in silence, who might not know where to turn, that should be particularly on our radar. And that's what the duty of zakat reminds us of. All I will say is that at National Zakat Foundation, we really are seeking to find ways to embed our work in community, to make it more accessible, and to make it more a point of coming together so that community is strengthened thereby. It's not about connecting to NZF, but connecting to each other, and for us to have a role in facilitating that. I'd encourage everyone, if you want to keep up with our work and support us, if you go to the nzf.org.uk website, you can just sign up for our newsletter, and that's a way for us to keep in touch. And I've shared my email here. We have Jamal here, Head of Supporter Relations. He can share his email with you all as well. I do encourage you all to reach out, stay in touch, share your ideas. I hope we can work together to build a better future. Thank you all very, very much.
Jazakumullah khair, Dr. Sohail, thank you very much. And I was just looking for your email address because I was going to shout it out anyway.
I put it into the chat. I can type it again.
Yeah, if you can,
of the chat.
I think it's lost in all the Q&As.
Yeah, sure.
So yeah, that's perfect. And of course, National Zakat Foundation is doing great work. So if any one of you is interested in working together with National Zakat Foundation, and some of you have suggested some very, very good ideas, perhaps National Zakat Foundation could take them on board and to see if they can work with you on those ones. I would definitely encourage you to get in touch and support NZF as well. Dr. Imrana, from the medical perspective, but also from the BIMA perspective, your final words, please.
I think the only thing really left to say, I think, because Dr. Sohail has captured a lot of it, is when I came into this webinar, I did feel this is going to be depressing, and I wanted to share a bit of hope with people. But I think what's happened is the reverse, is that I've been given hope by our participants, and I just really wanted to say thank you and jazakallah khair for our participants. You really have given me hope, because there's so much amazing work out there. There's so much, you know, good intention, energy. I think, you know, by working together, we can, you know, we can make the future better, inshallah.
Inshallah. Jazakumullah khair. Thank you so much. So the email addresses, if anyone is interested in getting in touch with Dr. Imrana, is, I'm just I'm struggling with all the messages here. Dr. Imrana, your email address.
I'll pop it in there as well. And sorry, I should have said,
Okay,
because
fine.
I am part of BEMA, I'll pop the BEMA website address in there as well, inshallah.
Okay, that's great. Jazakumullah khair, everyone. And I know many of you have shared positive signposting to many different services that are available. I know some of you are probably going through struggles and difficulties, whether that's landlord issues, maintenance issues, bills, rent, careers, jobs, whatever difficulty you are facing, please do not suffer in silence. Speak to somebody. Dr. Imran mentioned so many different facilities and support schemes available through the NHS. Go and speak to your GP, speak to your doctor. If that's not possible, please speak to a family member. And if that's not possible, speak to a friend. But please do not keep it within yourselves. And NZF has got a very, very good support scheme. If anyone is struggling financially and you're facing debts, National Zakat Foundation will be able to help you and support you. Please contact them for an application form, and all of your details will be confidentially dealt with. And if you're eligible, of course, you'll be getting support from them, inshallah ta'ala. That's all we have time for here tonight. Brothers and sisters, ladies and gentlemen, it's been an absolute pleasure. Thank you, Dr. Sohail, for your valuable time, as well as Dr. Imrana for your precious time as well. We are grateful. And to all of you participants, I hope you found it positive. I hope you found it useful. And I'd also like to share my gratitude with you all for signposting from your perspective and sharing your comments and feedback. It's definitely been an eye-opener. Jazakumullah khair. Thank you very much. Until the next time, look after yourselves. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum wa rahmatullahi wa barakatuh.